I'm Dr. Corey Calkins. I want to give you a quick summary of what memory reconsolidation is. In a different video, we discussed neural networks and their involvement in encoding of memories. And right now I want to describe a little bit about memory reconsolidation and its role in shifting our mindset to change the neural network in order to experience it a little differently going forward. Before I do that, I want to talk about a little bit that I think that our brains and our bodies, even though survival really is our top priority, our brains and bodies really are wired to heal. So I think that, when we've experienced something traumatic, once that threat has passed, if the threat is still ongoing, we're still going to be in survival mode. But once the threat has passed, our minds will continue to repeat it over and over again because we're trying to make sense of it. We're trying to desensitize that information possibly. We're trying to reconsolidate that information possibly. We're trying to make better sense of it and have a different experience of it moving forward. But with trauma, that memory sometimes gets stuck. We don't encode trauma memories the same way we do others. Sometimes that information is fragmented. Sometimes there's so much going on in that moment that we can't sequence the information properly. So these memories get encoded in a very rigid way at times, and it is difficult to disrupt them. But we can, and it is possible. So memory reconsolidation is a method for doing that. It isn't a specific type of treatment. It is a process that different types of treatments, can use in order to help people with traumatic memories. So EMDR is one of them. It is very different than systematic desensitization or exposure therapy. The thing they both have in common is that there is some level of exposure when we activate the memory, right? So we need to activate the neural network. That is step number one. So with exposure therapy or systematic desensitization, you are exposing to that active network repetitively, right? Now the difference is in memory reconsolidation, once we have activated the neural network that's associated with that memory, we want to now step two is disrupt that network. So we want to disrupt the network with something contradictory, a different experience, a different understanding, a different sensation. So some way it changes the neural network. So when it changes the neural network in working memory while we're thinking about it, now that becomes encoded as sort of a different neural network, right? So now when you are repetitively going back to this memory, it's a different experience. It's different than the original memory. And so if we can reconsolidate that, we can make it less distressing, more tolerable, something that you can work with a little bit better moving forward.